There have been long and persistent patterns of populations that have less social power and who experience multiple sources of oppression and exclusion, including structural racism, having worse health outcomes than populations with greater social advantage. These past 3 years have brought both increased attention to issues of health equity as well as exacerbated many of our pre-existing health equity challenges. The Institute for Health Equity and Social Justice Research is devoted to research and its practical application to improve the health and well-being of the residents of our communities. The Institute is focused on the social determinants of health in community settings, the promotion of health equity, and the elimination of health inequities.
So when we're thinking about research, I think oftentimes we focus a lot on the why, like why we do research, what we do in terms of research, how we do it. And the who is so important because that's essentially what the research is for, is to then ultimately help the community. And then in terms of, well, community partners definitely need to be part of that conversation to let us know to what extent that we can best support their needs, interests, goals, and so forth in the context of that research. The Sallius Populi project that we're currently working on is funded by the Robert Wood Johnson Foundation and the W.K. Kellogg Foundation. And it's a judiciary educational program, really first of its kind, to train judges on the social determinants of health. And what's really awesome and important about this work is it's allowing for upstream change. And we're evaluating what that upstream change can look like, especially as we're working with judges and in those legal spaces.
So for the past 10 years, we've been working on studies in one particular area on helping children who have been exposed to violence and other adversities in their families, working with pediatrics and community health centers to really help facilitate those who are having trouble with social, emotional, behavioral problems get the treatment and the case coordination kind of work that they need. So we have this innovative model called Project Launch that we've done a number of different evaluation studies on that puts a family partner who's a person with lived experience and a clinician that's trained in early childhood mental health services into pediatrics. Later, we expanded that to other cities around Massachusetts, and now we're working with kids who are in foster care. So that's an example of, kids who have been exposed to violence, what can we do about helping them take care of their social, behavioral, emotional needs.
Our research together involves community representatives, and in this case, because we're doing research on how artists support improvements in health equity for Boston's historically Black and Latinx neighborhoods, that involves recruiting artists to be a part of this research team.
So race is the biggest issue, and we're investigating what is it that artists of color need to survive. So we know that art touches everything, it touches the world. So we're using artists as the core to investigating health outcomes.
I love the Institute because it has faculty members across disciplines and across interests. Some folks that are interested in qualitative work, some folks that are interested in quantitative work. They're coming from law and health and sociology, music even, and combining those interests together to promote health equity in a number of different realms. And I really appreciate seeing like-minded folks working together on different problems to solve a bigger problem of health inequity.
So the Health Equity Internship program is our way at the Institute to formalize really training the undergraduate student in public health and health equity related research. It consists of pairing at least two health equity interns with a research faculty member or research advisor, and we have them do experiential learning, and then that they have 4 hours a week doing that research with the faculty advisor. And then there's a training component, which we train undergraduate students on the different skills related to research.
I think in a word, it's been authentic, and that we students can be our authentic selves because the faculty have modeled that for us. And through that authenticity, we're able to do impactful work and learn much more freely and much more in an engaged way.
I do plan to go to medical school, and I think working on this project has taught me how to value the community as experts in their own right. So considering artists as experts in the community, tailoring solutions that they will find useful and not imposing solutions on a community just because we think it's the right thing to do.
The future of the Institute for Health Equity and Social Justice Research is going to be dictated by the change agents that we are producing through our education, our faculty who are advancing knowledge in public health and population health, because they are immersed in the settings where these solutions are needed for the challenges that are presented to them and to the partners they work with.
Northeastern University has been growing, and our global campus network now includes campuses in new locations on the West Coast and abroad, providing us an opportunity to think about what true community academic partnership can look like in a wide range of communities. I'm also mostly excited about our students and our stellar junior scholars. I'm invigorated and inspired by their energy and passion and commitments to trying new approaches, taking academic risk, and thinking creatively about how to work across boundaries and improve the health and well-being of our communities with our communities.